There's over 400,000 patients in Australia that are suffering from chronic wounds at any point in time, and the problem is that we haven't really looked at this situation and the magnitude of it and the cost to the community and the healthcare budget. And this needs to be addressed, and how we can address this is getting patients accessed into wound experts sooner. Yeah, these are chronic wounds that are slow to heal and affect over 400,000 people in Australia at any one point in time. We have various people that look after patients with wounds depending on their condition. They can certainly be a medical officer that has undergone training in wound management. There are nurses, there are nurse practitioners across Australia in wound management. There are clinical nurse consultants, there's clinical nurse specialists, but there are allied health as well. And patients with our rising diabetes population, we are having more and more podiatrists involved in wound management, and we need to all work as part of a team to help our patients heal. Chronic wound can be described as something that's slow to heal, and these can be combined of venous leg ulcers, arterial leg ulcers, diabetic foot ulcer, pressure wounds. And so unfortunately, when we have these type of wounds, it does take a lot of work and it takes a lot of experience to be able to move these patients forward and get these wounds to heal. We can have patients that are too frightened to nurse their grandchildren because the risk of doing harm to their lower leg that they may have an ulcer with. So they isolate themselves, they don't want to socialise with their friend, they're frightened that they'll have leaky bandages and there could be odour present, and so their quality of life deteriorates. If you've got a wound that's slow to heal, you need to get a wound expert, and you can find a wound expert in your local area if you go to www.woundexperts.com.au.